Good afternoon, one and all. Today I'm Dr. Chetan John Raskina, consultant orthopedic surgeon from Hosmat Hospitals, Bangalore. So I'm basically specialized in robotic as well as conventional knee replacement surgeries as well as scopy, trauma, foot and ankle. So today, as you know, on this portal, we'd like to discuss about osteoporosis and bone health management and its day-to-day effects on our life. So to brief you about what is osteoporosis, it's a disease, okay, that causes your bones to become weak or fragile, commonly which leads to fractures unknown to us, and usually clinically we come to know when the patient walks into our OPD setup and we take an X-ray. So they'll have non-specific pains, ignored back pains, which they would have had a fall a couple of weeks ago and they ignore it. So osteoporosis is common among women post-menopausal age group because the estrogen levels come down. That leads to decrease in their bone mineral density, leading to increased bone pains, and trivial traumas can lead to major fractures. So, again, the burning question: how do we treat? How do we come to know it is a silent disease and there are no symptoms? It's what you feel. Some people have pain in the adjacent joint, but actually, if the wrist is paining, they'll come have some pain in their forearm or elbow. So when we examine or we diagnose on radiography, we come to know she's having an hairline fracture. Okay, so this condition usually occurs when a person has a slip from stairs or trivial traumas. Okay, so it is inevitable part of aging, yes, but then it can be prevented when managed early and diagnosed early. So the main goal is to prevent the fracture in the first place. So as you know, so this is a normal bone. So on the extreme where my pen I'm holding, no, this is the normal trabecular pattern. So this is what we want to achieve. So this is what happens when there is osteoporosis. The trabecular pattern network, the compact network is lost. So what we have is these huge craters, as you can see. So when between craters there is no bone left, it can fracture. So this is what we call an osteoporotic bone, and this is the normal bone. So this is a model to show you cut section of a femur bone or long leg. Okay. So, what causes osteoporosis? Again, a lot of factors, important factors. Common is female, postmenopausal, early family history of osteoporosis, lack of exercising, again, small body framework, low calcium intake, a lot of vitamin D deficiency we see nowadays. Again, our lifestyle, smoking, alcohol, and really it usually also systemic diseases we come across commonly in our OPD, rheumatoid arthritis, and in some medical conditions like hyperthyroidism, hyperparathyroidism, or hypogonadism. Certain medications like your thyroid medications and your antipsychotics, phenobarbital, and steroids, long-term steroids. Okay, so asthmatic patients should worry about getting osteoporosis earlier than others. Long-term steroid usage. So how do I know whether I have osteoporosis? Again, long-term joint pains, non-specific bone pains, and especially they will have a deformed spine or they will have a hump known as Downger's hump. Okay, it's an unexplained hump in the back because of the in uneventable fractures which they have neglected over a period of time. Okay, so the best diagnostic tool is an X-ray. Okay, and nowadays we have what is known as bone mineral density (BMD) testing. It's nothing but dual energy X-ray absorptiometry procedure. It is has lower radiation levels than a usual X-ray, and it can detect early. Okay, so in an X-ray, usually 30% of the bone mineral, the bone mass in this model, 30% has to be lost to find out that the person is osteoporotic. But in a DEXA scan, it is a simple test where the patient has lesser radiation, and it's a quick tool to diagnose your osteoporotic fractures. Okay. So again, DEXA, there are three values we get. One is in a DEXA, there is 0, -1, +1, and -2.5. So if the value is in a negative balance, it means that you are more into osteopenia and osteoporosis, whereas 0 to positive +1 shows that you have a lower risk of fracture, normal bone mineral values. So again, we have screening tests for these, where you have portable machines where we get to lot of your companies or to camps like OPD camps, wherein the patient or the person getting screened can use. We ask them to expose their heel, and then we take the average. That is an average. It is just a screening test, but the exact one is a DEXA. So who needs a bone mineral density test? Those who are estrogen deficient women, especially on hormonal therapies. Again, uh, some patients who are taking long-term corticosteroids, primary hyperthyroidism, and monitoring. Already patients who are found to have osteoporosis, we put them into a BMD test after 6 months or later to find out how they are responding to the supplements. So, how do you treat? So, what do you need to do? Basically, exercise, walk, okay, axial loading of your body. Do any form of exercise which is good for you, okay, and especially again we can take diet, calcium in our diet, eggs, like meat, even vegetables, pulses, okay, to some extent, and again fish, good source of calcium. Otherwise, we can also supplement them with calcium, which is 1,000 milligrams a day for adults, 1,200 young male adults, and 1,200 for women. And this is especially for women over the age of 50 years, wherein their estrogen levels come down. Again, along with calcium, you have to take supplements of vitamin D. The best source of vitamin D, to tell you, is our own natural sunlight. So people need to be exposed to around 20 minutes to 30 minutes of sunlight every day. Again, then what we do is, again we have medications apart from calcium. If the person is severely osteoporotic, we give them what is known as bisphosphonates. But again, they are anti-resorptive drugs, and studies have shown that it decreases the chances of fracture. You get orals, you get injectables, IV, as well as you get these insulin like pen injections. Again, under that you have different forms. Again, there is a newer drug which is now commonly used, known as calcitonin nasal sprays. Easy to use, uh, cost effective, and also it is only through intranasal or nostrils, alternate nostrils, it can be applied. Then again, for the ladies, we use what is known as estrogen or hormonal replacement therapies, selective SERMs. They are selective estrogen receptor modulator drugs which have anti-resorptive properties but can cause breast cancer. So we do not, unless the female patient is very, very osteoporotic and not responding to other drugs. Then we have teriparatide, which is also a parathormone drug, form of a parathormone, which helps to cause increased resorption in bones and treat osteoporosis. Okay. So again, the need for calcium will be more in pregnancy and postpartum. So many of our Indian population avoid taking calcium post pregnancy. So again, I always stress 6 months postpartum they have to take good amount of calcium, either in the form of capsules or also good diet. So bisphosphonates and the teriparatide injections are contraindicated in pregnancy. Okay. So how do we prevent it? Minimum dose of calcium per day. Okay. Any form of calcium dietary 1000 to 1200 milligram per day. Vitamin D is 400 to 1000 international units. Stop smoking. Avoid alcohol. Again, engage in some basic weight training exercises and have a good normal exercise routine exposed to the sunlight. Okay. And never stop any medication without consulting your doctor. So again, what is the impact of osteoporosis on our health? Or osteoporosis can lead to easy fractures, debility, immobility, and it can even uh, lead us from our prevent us from our daily routine activities. And if not treated early, if it leads to any spinal fracture, can lead to paralysis. So if you have had a fall and you have neglected, please don't do so, especially if it comes to the spine. Okay. So if we have osteoporosis, again medications, and how do we live with it? Use a walking aid, remove any hazardous slippery materials, especially for the elderly at home. Then get help by carry when getting hold of heavy items or anything. Just make sure that you have protective gear like a belt, or get somebody's help, and use or wear sturdy shoes so that you don't injure your joints. And make sure you visit orthopedician at least every 6 months if you are already an osteoporotic patient on medication. Okay. So points to remember: make sure you take important calcium and vitamin D in your diet. Physical activity as per your body needs and your age limits. So you do daily walking, weight minimal weight training exercises, change lifestyle, and also decrease your risk of falling. And if at all you have had any issue, please show the doctor immediately and don't neglect. Okay. So to summarize, I will tell you a caption: don't let your bones age faster than you. So take the right diet, the right amount of exercise needed. Don't overdo anything, don't underdo. Okay. So with this, I'd like to conclude, and thank you very much. I will take your questions. Right. Okay. So coming to the food, what food items are must to have better bone health, and what food items must be avoided? Again, going back, as I've already mentioned, your daily diet, good amount, balanced diet of fruits and good number of eggs. If you're vegetarian nowadays, you have soya, you have tofu, and you have a lot of pulses. Ragi for vegetarians is good. Any form of maize or millets. Okay. For non-vegetarians, of course, fish, chicken, any form, eggs, at least twice a week will really help in a long way. And again, along with this, there should be a balance of exercise. So excess of only eating and no exercise also can weaken your body. Okay. And avoid, what should we avoid? Colas, junk food, and your Pepsis, sodas, all artificial sweeteners. Everything are small in small quantities over a good amount of period of time can cause weakening of the bones. Okay, so we always stress on that. So what supplement medication for 65 plus for joint pains and general fitness? General fitness 65 years, we recommend around 20 to 30 minutes a day of normal walking. Okay, normal walking. And what supplements they can, probably they will not eat as much as a 35-year-old, so they will need to split their nutrition and meals in accordance. Okay, so small portions at frequent intervals of 2 3 hours. Diets can be the same, and you can supplement them with some calcium supplements for a period of 3 months, not more than. Age over 40, overweight, cause of ankle, causes of ankle solution. Okay, overweight again. Yeah, you have to know your BMI. If overweight causing ankle issues, then it is a problem. Yes, it is just the axial load or the body weight which is causing problem. So again, cut down on your BMI, cut down on your weight, do basic exercises to avoid having your ankle pains. If running or walking is not possible, try to do some other activity like swimming or basic sitting and doing basic weight training. Then, as I have already explained, diet can remain the same. So, a balance of diet and diet as well as weight training should help you to reduce. So, bone edema, consequences, side effects of medicine. See, there's a myth saying that long-term taking of your calcium supplements causes kidney stones. Okay, so I have over my experience of orthopedics, I've heard a lot of complaints like this. So there is no such thing of bone edema, as I've already explained to you in this model. Okay, so we need to achieve this. So when this is happened, we want to get back to this. Okay, so this matrix will only form when you deposit calcium, either through nutrition, through food, or through medication. So there is no hard and fast rule, or there is a saying that if you take long-term calcium, you're getting kidney stones. That's a wrong notion. But then the thing is, what calcium we take gets absorbed by our intestine, and the remaining is excreted. So what is needed by our bone will help to replenish this void and prevent fractures. Side effects, I don't think nowadays you have a good amount of calciums which are gastric safe. Yes, before they had gastric issues, but now I think most of the calciums are gastric and renal safe. Okay, the next question: all other alternatives than replacement in chronic knee pain. Again, chronic knee pain, more than 10 years on X-ray or CT scan, found to be grade 3 or 4, 3 plus 4, will definitely go for a knee replacement. Better than the taking painkillers, of course. I am not for painkillers, but again, painkillers on long term will do a lot of harm than doing good. It will always lead to kidney ailments and kidney failures. So again, alternatives, early stage, that is grade 1, grade 2, you have these visco supplement injections, you have what is known as PRPs. Latest, there are newer modalities of physio where they will use magnetic therapy and things like that. So along with the basic amount of good strength training to the core muscles of the knee, probably you can push it for some time. But then eventually, if it crosses grade 3 plus, then it needs surgeries. So again, I have intermittent uncomfortable minor pain in my left leg. Past 5 to 6 years. Yeah, again, age has not been mentioned. So 5 to 6 years, you have to get it evaluated. So you have to show. So it all pains to the knee doesn't mean that you have osteoarthritis. It could be sports injuries. It could be twisting injuries. There are a lot of ligaments around it. So it could be ligamentous. It could be due to your varicose veins or your DVT, deep vein. So all this needs to be ruled out. So basically, you'll have to go and get the leg checked up and then investigated accordingly. So the next question: how to recover from chikungunya induced joint pains? Okay. So initially, yes, you need to do. You would have taken medications, painkillers, all that. So again, you have to do strength training, basic core strengthening of the knee, physio, okay, and good amount of supplements with basic training for your the core muscles. Strengthening of your core muscles will help because it's a viral condition. It will cause some amount of synovitis, inflammation. It's known as post-viral arthralgias. So the initial phase, yes, you will need some pain pain suppressants and medications for it. Again, you can improve through physio and good amount of core strength training. How to maintain cartilage health? Again, don't overdo. I always am stressing on that. You go to the gym. Now the new fashion is to use a treadmill. So again, treadmill people have used treadmills on incline or more than their speed, so which has caused them problems down the line. So what I always suggest is uh, eat good amount of collagens. Your cartilage is made up of collagens, so again, good amount of eggs and good amount of pulses for vegetarians, ragi, right amount of exercise. If you are used to 20 minutes, do those 20 minutes. Again, you're not used to the treadmill, you don't have to jump to the treadmill. There is a stage in which you can slowly increase the pace, and always level ground walking or level firm ground walking is always advisable to prevent and this thing and prolong your cartilage life. Okay, next question. What are the natural ways of healing joint pains and the reason of pain? See, again, reason of pains, there are a lot of reasons from the synovial covering onwards. Synovitis could be viral. There was already a question on top. Chikungunya, there are either viral or inflammatory due to your diseases, rheumatoid arthritis and gouty arthritis. There are so many inflammatory conditions, and also degenerative, as you know, is osteoarthritis, where there is wear and tear and thinning of the cartilage. And also this, also we see it more common in sports injury people nowadays, where they have ACL and meniscus tears. So there are multiple ways of injuring the knee. The natural way of healing it is initially is just ice packs and limb elevation is the mainstay, along with some medications to help to relieve the pain. Yes, and then strength training and knee exercising through physio, through a trained physio, is always helpful. Back pain problems. Again, you should know your source of your back pain, whether your bones are weak, as I've stressed again and again multiple times. You can find out on a BMD or you can do X-ray and find out. But if at all, you will have to further investigate to find out if you have any facetal joint arthropathy or disc. Okay, most commonly cervical or lumbar discs, which causes referred pain. and accordingly you will have to manage. Treatment will be with your back extension exercises, physio management, and some medication. Again, if you find out that your bones are weak, you'll have to take supplements for the same. And then if it doesn't help, yeah, you need to consult the orthopedician for the further management. So again, exercises and strength training of your back is very important. So how to cure our bones in future? See, again, go back to our old school of diet, healthy diet. Eat more at home and less outside. Avoid junk food. Um, try to give some time to your body for exercising and exposed to sunlight. So either it can be nowadays we have a form of cycling, or we go to a health club, or we swim. So if nothing, at least basic walking for around 40 minutes with good exposure to sunlight. Is it okay to have calcium tablets daily? Yes. Um, Calcium tablets daily, once a day, unless you have been diagnosed as an osteoporotic person, then maybe the dose can change. So again, calcium tablets for 1 or 2 months, no harm. And now you have gastric safe tablets, which prevent gastritis rather. So that can be recommended. So yeah. So is treadmill okay or brisk walking? See, treadmill is always a machine. I always tell my patients, no harm as long as you know whether you can cope up at that speed. When you are fighting against a machine, what happens is the wear and tear is more. So the question is apt: treadmill or brisk walking? Again, brisk walking, I don't expect you to walk so fast that you can feel your heartbeat. People think that by sweating and uh, by increasing your heart rate is good. It's wrong. If you ask any cardiologist, they will tell you the same. So basically, you should know how what is your endurance level. If you're not used to walking, even 5-10 minutes today, if you start 5-10 minutes, will cause you to have fatigue. So that is your limit for today. Rather, it will be the same for 1 month. So every month or every quarterly, you can increase your stamina or your stance. I always prefer brisk walk. Natural, your foot can adapt to the level or the uneven surface of the ground, and you will have better proprioception of your body and your joints as well to level ground walking compared to a machine or treadmill. Okay, next question is cycling good for the joints? Yes, cycling is good, but again, for early osteoarthritic patients, we recommend recombinant cycling. Recombinant cycling is it's a static cycle wherein it's available in gyms or in health clubs, where you can push the seat back to the extreme so that your legs are extended fully, almost to full extension. And when you cycle in that way, you're not damaging your cartilage. It helps in lubrication and synovial fluid generation. Yeah. Can a person who is operated for ACL undergo TKR? Yeah, definitely. There's no doubt a person operated for ACL will undergo TKR only. TKR is usually done after the age of 60, unless it severely affected his joints in rheumatoid arthritis or something where he is not able to walk. His daily activities of living are hampered. Is when we do it earlier. But then usually I don't think ACL has any effect of doing TKR. we will have to anyway sacrifice the ACL part to put the implant in. So yes, he can undergo. Definitely, can ACL surgery be redone? Yes. At our setup, yes, we are doing. We use grafts from different areas of the legs, so it can be definitely redone if there has been a failure in the first surgery. Is it safe to undergo hip replacement after knee replacement? Yes, there is no contraindication in undergoing a hip replacement. If at all, to restore biomechanics, if the person is all limping and is in pain, there's no harm in undergoing a knee replacement. So to summarize, all what I've said, take care of your bones, and that's the most important and neglected part of our body. We take it for granted, but then over the years, we come to know either because of lack of exercise or lack of our diet or management, we end up with creaking and painful joints and bones. So, what I suggest is take care of your health, good normal diet, and a healthy lifestyle, as in packed with at least 40 minutes of normal walking with exposure to sunlight. This is what I keep telling, and this is what I'd like to summarize and conclude. So, have healthy bones, which will keep you going for a longer period. Thank you.